My name is Robin Peace, and I am a family physician. I came to Lumberton 18 years ago. It will be 19 years in August, from Greenville, North Carolina. I'm from North Carolina. I've never lived in any other state. I went to undergrad at Chapel Hill, and I did my medical school training and residency in Greenville. And from Greenville, I came here. I've never practiced medicine anywhere else but Robeson County. I live right here in Lumberton. I live in the same house that I bought in 1998 when I came, and I don't regret that decision at all. I hate traffic, so it is convenient, for one, for me to live in Lumberton and be around the corner from my practice, to be within 5 minutes of a hospital. I enjoy the neighborhood that I stay in. I can run. I enjoy being close to my church. So I haven't regretted the decision to live right in Lumberton. I've never considered moving since I came. I'm in the same house. I'm looking forward to getting it paid off and maybe getting a place at the beach so that I can, dash down on the weekends. I'm looking ahead. I plan to retire here. I feel like I am sewn into the fabric of Robeson County now because I have extended myself. The more you give, the more it comes back. And so the more I extend myself to the community, the more pleasure I get, the more I feel like I'm supposed to be here. I think that for people like myself that come and stay, it is because of the relationships that are built within the professional community, within their faith, their individual faith, and with the patient. This is my family. I have a professional family, I have a church family, I have a community family, I have patients that are like family, that consider me like a part of their family.
I'm Josh Freeman, I'm a nurse practitioner with Southeastern Health with the neurosurgery department here at Southeastern Health. Graduated from UNC Chapel Hill in 2014 and completed a neurosurgery rotation at Duke Riley Hospital with the neurosurgery department at Duke Riley Hospital in 2014 as well. Before moving back and starting practice in Lumberton. I love my job. I love working at Southeastern. It is an organization where it's big enough where you have enough specialties to be able to, where you still know each provider by name, so you're able to call them and talk to them about a patient. Everybody always has time to talk to you about a patient. I live near the hospital, so I run in this area and feel very safe here. And know a lot of people as well that live in the area. And there's so many resources here. It's always evolving. There's always teaching going on. You walk through the hospital and you see med students, you see nursing students, PA students, nurse practitioner students from all over the state, from Duke and Chapel Hill, training in Lumberton. So I think it's a great place to work. Being born and raised in Lumberton, I love it here because it's just close proximity to the beach. As well as to the mountains if you needed to. The cost of living here in Lumberton is very reasonable. I feel very safe to live here. Lumberton is growing every day. Every year they're adding restaurants, they're adding new stores. You're in close proximity to Fayetteville. You're right here at 95 and 74, two major interstates that can get you to any of the bigger towns in the area.
My name is Terry Lowry. I was born in Robeson County at Lumberton Hospital, so I know all the ins and outs of the community and the people. I traveled to UNC Chapel Hill and did both undergraduate and medical school, and then from there Rochester, New York, where I studied general surgery and then fellowship in cardiothoracic surgery. I really did that because I wanted to see what life was like outside Robeson County, because I really had never been anywhere else. And so it was a new experience. Heart disease was always a very common thing when I was growing up. Lots of people had it. Many people traveled outside the community to get care. I became interested in heart disease as a result of that, and wound up wanting to be a cardiothoracic surgeon after doing some volunteer work at UNC Chapel Hill and watching open heart cases. While I was up there, I found that most patients who were seen in Lumberton who had complex cardiac disease went to Duke for their treatment, and that Duke and Southeastern were working together to bring a heart center to Lumberton. And so while I was doing my fellowship, that happened. They signed the deal on the heart center, and I was able to interview and fortunately was able to get the job and come back to where I grew up in order to practice, taking care of heart patients. Compared to where I trained, the weather is outstanding. There's not much traffic. I can leave home and be at work in just a few minutes, no matter what time of the day it is, regardless of how heavy the traffic is. But you're also close to everything. I'm close to the beach, close to the mountains. If I want to do outdoor stuff, there's plenty of opportunity to do that. If I want to go do theater or anything like that, it's a short trip to UNC Pembroke or Chapel Hill, Durham, or even down to Myrtle Beach. So, lots of opportunity to do things in this area without being in the hustle and bustle of a busy city environment. You hear things on the internet and on the news about crime, but no matter where you go, there's crime. I've been to major cities, I've been to small cities when I was looking for residency programs as well as fellowship programs. And I think in every city that I wound up in the bad neighborhood where people told me that I must have lost my mind going to that area. But I've even been to some hospitals that were in the bad neighborhood. So there's crime and there are bad neighborhoods no matter where you go. For the most part, Lumberton is a very nice place to live. You rarely see anything related to the bad parts that you see on the internet and on the news. You're interested in coming here, then probably my advice would be to, take less stock in what you read and more stock in the people that you meet. You want to talk to someone who's been here for a while, having moved from someplace else, and to get their experience. You want to talk to someone who's been here their entire life and get their experience. And I think if you're able to do that, then you'll get a more robust idea of what it's like living in the area and what the opportunities are. There are lots of opportunities for kids in school and good schools, as well as extracurricular things. I think the biggest thing for me for practicing here was one, I grew up here and I had a relationship with the people and the ways that they do things in the community, and as a result, I'm able to come back and I know a lot of people and a lot of people know me, so it was an easy way to build a practice, but I think the more important thing is that financially most patients can't really afford to travel to get care that they need. So for me it was really rewarding to be able to come back and provide that service and allow as many patients as possible to stay in the community. That not only helps them but brings jobs to the community and helps the community out as well. But it's also very rewarding because those patients are very appreciative for everything that you do